I'm honored to be with you this morning on this very special occasion. I thank you for having already introduced my floor leaders that are here with you today, as well as the minority leader and other members of the General Assembly who have seen fit to spend a few minutes with us this morning. I appreciate all of them being here because the event that will be the culmination of today, for me at least, could not have occurred without their help and without the help of many other members of the General Assembly as we dealt with this issue of a provider fee. I don't think I have to say too much to this audience about the challenges that we're facing in healthcare delivery in our state and in our country. You are literally on the tip of the spear. You see it every day. You know that the expectations of the public are exceedingly high, and they will continue to grow. It's sort of like a story that I have repeated as I have talked to some of my physician friends over the years, and they tell stories about this as well. If you haven't noticed, second only to lawyers advertising their services is the advertisement of prescription drugs that will solve every problem that you have. Now, the disclaimer clause, of course, if you listen to that, that'll scare you to death because, you know, all those symptoms that are potential byproducts of taking this pill, if you really listen to that, you wouldn't take it in the first place. And that's usually in a very low tone, very quickly spoken so that you gloss over that. But one of the problems that physicians say they have is the problem of their patients being self-diagnosing themselves. And they come into their offices and they say, well, doctor, I've got this, this, and this wrong with me, but if you'll just prescribe this particular medication, I have seen that ad, and I know that it's going to solve my problem. Now, I know some of you have had that similar experience. The expectations of the public are being heightened from every angle you could anticipate. Through advertising of products, through hearing about new research and breakthroughs, which of course we all are thrilled about, and our country still continues to be a leader in that. And we're very fortunate, I think, that over the years we have tried to modernize our methods of improving the research and development of new medical devices as well as new medical products coming to the marketplace. As many of you know, I spent quite a bit of time in the United States House of Representatives. I had the good fortune of being, at one time, the chairman of the Health Subcommittee of Energy and Commerce. And then, depending on which party was in power, I was no longer chairman, I became the ranking member, as we call the minority party's chief individual in that capacity. But during those years, I had an opportunity to look at what was happening in healthcare from a very close perspective. And we have a lot to be proud of in this country. We have a lot of good things that are happening, and sometimes the public doesn't know those good things. And that's probably the way it's going to continue. But what has to happen in the public arena, whether it be at the state level or at the federal level, is to make sure that government facilitates the good things and doesn't unduly get in the way of those who are trying to make those things happen, because they happen in the private arena. They happen in the development of products, in the providing of services. Government has a role to play, but it is not the predominant entity in that process. Now, we've come a long way, as I said earlier, and I think we are on the right track on many things. For example, in the pharmaceutical area, we have recognized that we need to be very cautious about putting products on the market, but by the same token, we need to be aggressive in getting products to the consumer. And we have seen through the Food and Drug Administration, new procedures and new policies, clinical trials that are more tailored to the individual needs of the people of this country, whether it be children who now you have to do clinical trials to tell if your particular product, how it affects children versus the normal clinical trials for adults, and a variety of things that are changing all the time. I think most of them are changes for the better. But as all of this takes place, there are costs associated with it. As the expectations of the public continues to grow, whether it be those advertisements about things that are the miracle cure for their particular problem, or whether or not it just be the expectation that somebody has a responsibility of making me feel better, and somebody has the responsibility of paying for making me feel better. We have lost, somewhere along the way, much of the individual responsibility associated with the overall delivery of health care. Now, we are trying to attack that from several different angles at the state level, because whether we like it or not, we are faced with a great irony in our state. We are one of those states that has, quite frankly, what is very close to an epidemic of childhood obesity. And yet, the other side of that coin is we have a lot of children that go hungry. We're doing a lot, I think, on both sides of that coin. We have one of the best food bank programs in the state of Georgia. It is certainly a strong component of the metro Atlanta area, and its outreach is spreading all across our state as we try to deliver the kind of food products, whether it be through our schools or through other programs, so that children do have a better diet and more appropriate food. But we're also doing, on the other side, trying to incorporate through our SHAPE initiative, through our schools, and through our Department of Public Health, encouraging activities that will keep our children healthier. So a lot of things are happening all around you, but you are at the heart of it. Because when people become ill, when something bad happens, they need a hospital, and they're going to come to your facilities. And you are going to have to live up to those expectations that have been generated not by you perhaps, but by the climate and the environment in which we live. And I understand that those challenges are great, and that there are costs associated with meeting those expectations. And you face those challenges every day as you try to keep your budgets balanced, just as the state tries to keep its budget balanced. That's why when we faced the situation we did this year of a potential almost $700 million hole in our Medicaid budget, that is why it was so important to all of us that you come together, that you work with us and the General Assembly, and that we come up with a solution. The provider fee that had been one of those ingredients that had helped fill those holes in the past was expired, and we had to figure out a way in which to fill the hole that was going to be created. I believe that the solution that was arrived at, and I'll be signing that bill here in just a few minutes, I believe the solution that this bill incorporates is a reasonable and workable solution to delegate the responsibility to the Board of Community Health to assess a provider fee. They have been doing it for the nursing home industry for many years, since about 2004. And it has worked very well in that component of healthcare delivery. So I want to especially thank those of you who are here today, this Georgia Hospital Association, and your willingness to work, and the other groups' willingness to work together. The Hometown Health Community, the Georgia Alliance of Community Hospitals, those three major entities came together, put aside differences that might otherwise be contentious, and recognized that there was a common need and a common purpose that was to be served. And without that cooperation on the part of these three groups, I don't believe we would be here at a point of today signing this legislation. So from me, and I think from the members of the General Assembly who are here as well, thank you for understanding the process and for being willing to arrive at a reasonable solution. I think it means a great deal not only for the immediate future, but also for the long-term delivery of health care in this state. Now, it is difficult for government sometimes to change the pattern of anything. Oh, we think we do, and we try to from time to time, but many times it is a very slow and arduous process of doing that. But what we sometimes can do is to address some of the more immediate and pressing needs of any particular sector within our society. This year, my budget proposes, for example, to recognize that we still have jobs that we are not filling with people in our state. And in your particular arena, one of those areas is with regard to nurses. So, one of the proposals that we have put in place is to say within our technical college community, which trains a lot of our nurses, is that we will give priority to those who pursue a nursing certificate or degree, and that if they do so, instead of receiving just the normal allocation of a HOPE grant, which is, of course, one component of our HOPE scholarship program, that they will be assured that at least 90+% of the cost of their pursuing that degree will be covered through the HOPE grant program. We know that this will attract more individuals to this very needed area and will help us fill those job slots that are not expected vacancies of the future, but are actual vacancies of the present. We think that makes good sense. As I said in the State of the State, that's putting your money where the jobs are. There are two other areas, not necessarily associated with you, but long-haul truck drivers, those who have commercial driver's licenses for our trucks is another area of shortage. And of course, those who are providing care in our early learning and our pre-K programs and child care programs is another important area. So we have funneled money into those three areas and given them a priority with regard to HOPE grants. Now, we also recognize that there are other areas where problems exist. Now, some of those we don't have the ability to address, but we are trying to keep our state in a balanced posture. Medicaid is already a great part of our state budget. It is very close at this point in time to being the second largest expenditure in our state budget. We all hear a lot of talk about the Affordable Care Act and its implications as it has unfolded since its passage a couple of years ago. And it is incremental in its unfolding, and it is somewhat incremental in its effects. Some of you have already felt the effects of some of the earlier provisions of that act when they came into play. At the state level, for example, with the mandated coverages that this law requires that have already taken effect, we have seen our state health benefit plan costs go up. Now, I somewhat jokingly say that I know it may be a good idea to allow families to cover their children up to age 26, but most people probably would prefer that they not have to do that and that they actually have a job of their own and get their own insurance. But that's one of those mandates. And even though there are certainly good reasons behind the mandated screenings that this legislation imposes, like everything, there are costs associated with it. So we have seen the cost of our state health benefit plan already increase because of some of these earlier provisions of the Affordable Care Act. The big one, of course, is next year. And as everybody makes preparations for and tries to anticipate what the expected effects of that legislation in 2014 is going to be, I still think we don't know all of the answers. I think this is probably a process that will continue to play out at the federal level. I think Congress is probably going to have to address some of the issues that have been left with some vacancies in the answers, as the Supreme Court gave at least the states some flexibility on the expansion of Medicaid. There are things that were not contemplated in the original legislation, because the original legislation contemplated that all Medicaid populations would be expanded, and there will be consequences. As we see the disproportionate share payments being reduced or potentially eliminated, I think that's an issue that Congress probably is going to have to revisit, because I'm sure some of your hospitals are very much dependent upon those DSH payments, and their absence and their elimination or reduction will have significant impacts on your bottom line. So I think we all have to be flexible as we watch this process unfold. We do know that it's probably going to affect the number of employers who provide health care. As you know, when the incentives were provided to employers to offer health care to their employees many years ago, it suddenly became the largest provider of benefits was through your employer. It's now a given that in virtually every employment situation, the expectation is that health care will be provided. Now, in some of our smaller companies, that of course has never occurred. It's not required, but generally, in a tight labor market, an employer who provides health coverage is going to get the better and more responsible employees. In a market such as the one we're in now, with heavy and high unemployment, not only in our state, but in many other parts of the country, some of those kind of economic pressures are not present. So therefore, the mandate of 50 or more employees of an employer being told and penalized if they do not provide health insurance, I think we still don't know how that's going to play out in the marketplace. So we all have to be anticipating that. The hope, of course, is that you will not see more people be uninsured, because that is one of the possible consequences, is that employers will take advantage either of paying the penalty, and of course if you look at the cost, the penalty is certainly less than the cost of providing on a per employee basis health coverage. So we don't know what all this is going to do in the greater scheme of things after 2014. But we have to be as prepared as we can. We do know that even though I've made the decision not to expand our Medicaid eligibility, we do know that we're having that so-called woodworking effect already happen in our state. And we anticipate that that will cost us about $1.7 billion over the next 10 years. Because we do have people who are currently eligible but not enrolled in our Medicaid program. But as the mandate of proving that you are covered by an insurance policy kicks in, the most obvious place to go is if you're eligible for Medicaid, then you're going to be enrolled and that will become your insurance provider. So we're going to have cost even without going to an expanded Medicaid eligibility. Now, those are just a few of the issues that I think all of us are going to be facing. And I want to pledge to you that I will always be willing to work with you, to listen to you, to try to understand the problems that you are confronted with, and to the extent that we can do so, we will try to make those problems either disappear or ameliorate them in some respect. Now, there are limited resources at the state level for us to do that sometimes. But we just want to make sure that our policies that we impose upon you are not an undue burden and something that you cannot bear. So the continued dialogue that has been generated around dialogue and that continued cooperative spirit I think probably will be very essential that we carry it on into the future in these coming years of great uncertainty as to where the delivery of health care is headed. Now, in just a few minutes, I'm going to step down and I'm going to spot the table here in just a minute. There, is that it over there? Okay. I'm going to be signing Senate Bill 24 here in just a minute. And it is, at least for the time being, we feel the best answer for being able to close that almost $700 million hole in our Medicaid program. It will allow the provider fee to be established by the State Board of Community Health. And as I said, they're already accustomed to doing that in the nursing home arena. So we have every reason to believe that it will work smoothly and efficiently. So in closing, let me go back to my initial statement. Thank you for your willingness to work with us. Thank you for understanding the difficulties that democracy and representative government imposes on us. We can't just dictate things. We have to work together. We have to work across party lines, and we have to work between government and the private community. And this is certainly an excellent example, I think, of all of those dynamics coming together as to one very important piece of legislation. I am honored to be with you today. I look forward to continuing to work with you as we move forward into the future. And I hope that you will continue to talk to us. Let us know what the problems are. And we will hopefully have the opportunity to work with the General Assembly, as some of those problems probably will show up on my desk at some time in the future. But for today, we're solving one of the big ones. And thank you for allowing us to do that in your presence this morning. Thank you.